Hello, my name is Loriani Mejia. Unit 4 Professional English in Use, chapters 22, 24 to 34. 24. Infections. Fever. A medical student has made some language note on a case report. Case 40, 45. A 24-year-old man presenting with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years later and glandular fever. Infection with Epstein-Barr virus at the age of 18 years. He had returned for Africa 3 weeks previously. Fever, pyrexia. Also remember PUO, pyrexia of unknown origin. Fever also known as temperature. I've got a temperature. Adjective. Feverish, febrile, and pyrexia, opposite. Febrile, pyrexia. Some symptoms of fever: sweating, rigors, severe shivering, and sensation of coldness, also known as chills. Em, Infecciones. Fiebre. Un estudiante de medicina ha hecho notas de lenguaje sobre un caso clínico. Caso 45. Un hombre de 24 años se presentó con fiebre que había tenido durante 3 días. Al tercer día había tenido un ataque severo de fiebre con sudoración y escalofríos. Los únicos antecedentes de interés fueron hepatitis 4 años antes y fiebre glandular. Infección por virus de Epstein-Barr a los 18 años. Había regresado de África 3 semanas antes. Fiebre es lo mismo que pirexia. Recuerda también PUO, pirexia de origen desconocido. Fiebre también conocida como temperatura. Tengo fiebre. Adjetivos. Febril es febril y pirexia. Opuestos: afebril y apirexial. Algunos síntomas de la fiebre: transpiración, escalofríos, temblores intensos y sensación de frío, también conocidos como escalofríos. B. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses or bacteria, that can usually be identified thus stabilizing the early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many non-infectious, degenerative, and chronic diseases, communicability is another factor which differentiates infections from non-infectious diseases. Transmission of pathogenic, pathogenic, pathogenic organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Finally, finally, many infections are preventable by hygienic measures, by vaccines, especially live-attendant vaccines such as rubella vaccine, or by drugs prophylaxis, for example, chloroquine to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that causes malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs, or bugs. Notice the common expressions for acquiring an infection diseases. Could I have caught some diseases from the dog? From the dog. Could I have picked up some diseases from the dog? I think I caught the fly bug that's going wrong. Microorganismos. Las infecciones difieren de otras enfermedades en varios aspectos. Lo más importante es que son causadas por microorganismos vivos, como virus o bacterias, que generalmente se pueden identificar, estableciendo así la etiología al principio de la enfermedad. Muchos de estos organismos, incluidas todas las bacterias, son sensibles a los antibióticos y la mayoría de las infecciones son potencialmente curables, a diferencia de muchas enfermedades crónicas y degenerativas no infecciosas. La transmisibilidad es otro factor de diferencia. Las infecciones de las enfermedades no infecciosas. La transmisión del organismo patogénico a otras personas, directa o indirectamente, puede conducir a un brote o epidemia. Otras infecciones se pueden prevenir con medidas higiénicas, como vacunas, especialmente vacunas vivas certificadas como la vacuna de rubéola, o con profilaxis farmacológica, por ejemplo, cloroquina para prevenir la malaria. Los microorganismos incluyen litis, virus, hongos, al igual que el parásito que causa la malaria. Otra maravilla general de esos patógenos son los microbios. Los pacientes a menudo se refieren a los microbios como gérmenes o insectos. Ten en cuenta los experimentos comunes para adquirir una enfermedad infecciosa. Podría haber atrapado la enfermedad del perro. Podría haber recogido la enfermedad del perro. Creo que me he contagiado del gusanillo de la gripe que anda dando vueltas. Sí, source and spread of infections. Here is an extract from a medical textbook. Infection may originate from the patient's endogenous, usually from skin, nasopharynx or bowel, or from outside sources, exogenous. Often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organisms in the throat, for example, diphtheria, bowel, salmonella, or blood hepatitis B or HIV. Non-human sources of infection include water, cholera, milk, tuberculosis, food, botulism, animals, rabies, bears, psicosis, and also the soil, Legionnaires diseases. The incubation period is the period between the invasion of the disease by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Fuente de propagación de la infección. Aquí hay un extracto de un libro de texto médico. La infección puede originarse en el paciente endógena, por lo general de la nasofarina de la piel o el intestino o de fuentes externas. A menudo su persona, que puede estar sufriendo una infección o portar un patógeno, la garganta, por ejemplo, difteria o la sangre, hepatitis. La fuente de infección humana se incluye en el agua, mezcla de cólera, alimentos, botulismo, animales, tuberculosis. No. Animales, travia, ligaduras y también la suya enfermedad de los legionarios. En el periodo de incubación es el periodo de tiempo en que la invasión de las bases por patógenos y la aparición de las características de fracción. El periodo de la infectividad es el tiempo que el paciente es infeccioso para los demás. Exercise 24.1. Mark the two parts of the sentences. Look at A, B, and C opposite to help you. One is you. Measles, mumps, and rubiola, MMR vaccine. 2 E. Ching. Oh. Okay. 1 19 88. So the UK launch of Live Attenuate. Measles, mumps, and rubiola, MMR vaccine. 2. Chinkspot varicella is a common infection. Diseases of childhood. 3. Rabies has an incubation period ranging from 4 days to many months. The patients remain febrile, with peaks of temperature of 89.5 Celsius. He was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic. Of AEDs. Measles, rubiola is most infectious during the catarrhal stage. Lyme disease is caused by transmission of border ferry from animal to man by exhaustic ticks. PUO stands for pyrexia of unknown origin. Complete the case report of the patient in A opposite. Look at A, B, and C opposite to help you. Case 4-5 on examination. He looked at annual his pulse rate was 100/minute. He had a papal spleen, the combination of fever and rigors, in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10, 10 to 14 days. In the case the patient admitted he had not been taking pro, prophylaxis regularly. The diagnosis was confirmed by the presence of parasitase in his blood film. Completed the sentences. Look at A, B, and C opposite to help you. An infection which can be treated successful with antibiotics is curable. Another word for an epidemic in an outbreak. Bacteria in viruses are example for microorganisms. Someone whose temperature is normal is a fever. The common infections with Epstein-Barr virus is known as glandular fever. Mental illness. A. Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain diseases. The commonest form of dementia is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed functional. These are described below. Substance, substance abuse. Um, Abuse of substances means using it in a way that is harmful. The commonest form of substance abuse are alcoholism and drug abuse. Enfermedad mental. Desórdenes psiquiátricos. Los trastornos psiquiátricos se pueden dividir en orgánicos y funcionales. La demencia es un trastorno mental debido a una enfermedad cerebral orgánica. La forma más común de demencia es la asociada con la demencia senil de la vejez. Los trastornos en los que no existe una patología evidente o un cambio anatómico en un órgano se denominan funcionales. Eso se escriben a continuación. Abuso de sustancias. El abuso de una sustancia significa usarla de una manera dañina. Las formas más comunes de abuso de sustancias son el alcoholismo y el abuso de drogas. Affective disorders. Here is an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotions, for example, happiness or sadness. Affect tends to be used for temporary emotions and is expressed through manner of speaking, facial expression or behavior. Moody is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, psychomotor agitation, excessive movement and fraud, or psychomotor retardation, slowing of movement and fruit, loss of interest in stimulation activities, decrease the ability to think and concentrate, feeling that one is of no value to others, or that one has done something, war, recurrent fraud of death or suicide, suicide. Five or possibility four of the outward symptoms occurring nearly every day for at least 2 weeks um, constitute a major depression. Trastornos afectivos. Aquí hay un extracto de un libro de texto de medicina. El afecto y el estado de ánimo tienen un significado similar y se refieren a las emociones, por ejemplo, felicidad o tristeza. Al afectar teniendo para ser usado para emociones temporales y expresadas a través de la forma de hablar, la expresión facial o el comportamiento. El estado de ánimo se utiliza para referirse a un estado emocional más permanente. La forma más común del trastorno afectivo son la depresión, cuyos síntomas son mal apetito y gran pérdida de peso, alteración del sueño, por ejemplo, insomnio, dificultad para dormir, fatiga, bajos de energía. Agitación psicomotora, movimientos y pensamientos expresivos o retraso psicomotor, ralentización del movimiento y pensamiento, pérdida de interés en la simulación de actividades, disminución de la capacidad para pensar y concentrarse, teniendo en cuenta que uno no tiene ningún valor para los demás o que uno ha hecho algo malo, pensamientos recurrentes de muerte o suicidio. 5 o posiblemente 4 de los síntomas anteriores que duren durante al menos 2 semanas pueden como reconstituir una depresión mayor. Neurotic and stress-related disorders. An example of neurotic disorders is of obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act, even though they recognize that it is unnecessary. A common form of this is compulsive watching of his hands. Hence, stress is a feeling of being unable to cope. It can lead to anxiety or fear or problems. A sudden attack of anxiety is called a panic attack. Other types of functional disorder. These included behavioral syndromes associated with psychological disturbance such as eating disorders of adult personality and behavior, for example, personality disorder, mental retardation, delayed mental development, um, schizophrenia, and other disorders is which there are delusions, false beliefs. Trastornos afectivos. Aquí hay un texto, aquí hay un extracto de un libro de texto de medicina. Ah, de trastornos neuróticos y relacionados con el estrés. Un ejemplo de trastorno neurótico es el trastorno obsesivo compulsivo o una obsesión es una idea, que es tan persistente que interfiere con la vida del paciente. Una compulsión es una idea obsesiva que obliga al paciente a actuar aunque reconoce que es innecesario. Una forma común de esto es el lavado compulsivo de manos. El estrés es una sensación de no poder hacerle frente. Puede provocar ansiedad o miedo a los problemas. Un ataque repentino de ansiedad es llamado ataque de pánico. Otros tipos de trastorno funcional. Estos incluyen síndromes conductuales asociados con alteraciones fisiológicas, como trastornos de la comida, trastornos de la personalidad y del comportamiento del adulto, por ejemplo, trastorno de la personalidad, retraso mental, el retraso en el desarrollo mental, esquizofrenia y otros trastornos en los que hay delirios, falsas creencias. Exercise. Complete the table with 4 words from A, C, D, and E opposites. Noun, adjective. Noun, affect. Adjective, affective. Anxiety, anxious. Behavior, behavioral. Dementia, demented. Disturbance, disturbed. Suicide, suicidal. Make word combination using a word from a box. 2 words can be used twice. Look at B, C, and E opposite to. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbation, substance abuse. Complete the sentences. Look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. A person's emotional state is a mood. A sudden attack of anxiety is panic attack. The form of dementia associated with again is called senile dementia. A disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Which symptoms of depression was this patient suffering from? Look at C opposite to happy. Case 41. Um, uh, a 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and to wake up early, but denied any suicidal tendency. She was 30 and was pacing urine more often. She was eating normally and her weight was steady. List. Tiredness, fatigue, loss of interest, sleeping poorly, insomnia. Ay. The nervous system 1. Sensory loss. The central nervous system controls the sensory and motor functions of the body. Diseases of this system therefore led to loss of some of these Functions. Loss other symptoms. Function. Hearing. Deafness. Bathing or reading in the car tinnitus. Sight. Blindness. Double vision. Diplopia. Blurring, loss of visual acuity, clarity of vision, sensation, feeling, numbness, anesthesia, tingling or pins and needles, paresthesia, balance, unsteadiness, attention, dizziness, vertigo. Note: there are no common words for loss of, or conditions relating to taste and smell. El sistema nervioso 1. Pérdida sensorial. El sistema nervioso central controla las funciones sensoriales y motoras del cuerpo. Las enfermedades del sistema, por lo tanto, conducen a bajas de algunas de esas funciones. Función. Función de audición. Pérdida sordera. Otros síntomas: zumbido o zumbido en el exterior. Tinnitus. Función, visión. Pérdida ceguera. Otros síntomas: visión doble, diplopia, flujo borroso, de agudeza visual, claridad de visión. Sensación de sentir, el sentido del tacto. Pérdida. Ok, anestesia. Otros síntomas: hormigueo u hormigueo. Inestabilidad del equilibrio, ataxia, mareo o vértigo. Nota: no hay palabras comunes para la pérdida de o condiciones relacionadas con el gusto y el olfato. Motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with hoarseness, erode the voice as in vocal cord paralysis, slurred speech means for poor articulation, as in several diseases. Pérdida de motor. Pérdida como de la sensación motora. Los signos y síntomas de la pérdida motora incluyen debilidad, pérdida del poder, parálisis, pérdida completa de la fuerza, temor, movimiento rítmico involuntario, especialmente en las manos, marcha anormal, manera habitual de caminar. El habla también puede verse afectada, por ejemplo, con ronquera, una voz áspera y profunda, como en la parálisis de las cuerdas vocales. La dificultad para hablar significa mala articulación, como en la enfermedad del cerebro. Loss of consciousness. Patients might describe sudden loss of consciousness in a number of ways. I passed out, had a blackout, fainted. I had a fit, stutter, convulsion. Fit, stutter, and convulsion are all used to refer to violent involuntary movement as in epilepsy. Doctors may say, "When did you lose consciousness?" Here is a page from a textbook on the cases of a loss of consciousness. The principal differential diagnosis is between an epileptic fit and psychotic attack or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished from a cerebral principle by the circumstance with which the event occurs. For example, um, um, sometimes a convulsions and urinary incontinence, loss of control of the bladder, occur even in psychopal attack. Thus, neither of these is specific for an epileptic attack. The day is the key is to establish the presence of abstinence of prodromal symptoms or symptoms that occur immediately before the attack. Psychonal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people might get a warning known as an aura that attack going to happen. Note: the noun convulsion is often used in plural form. He had convulsions as a child. Pérdida de la conciencia. Los pacientes pueden describir la pérdida repentina de conciencia de varias maneras. Tuve un desmayo, tuve un apagón o, perdí la conciencia. Fine. Tuve una convulsión, tuve una pérdida de forma. El ataque y la convulsión se utilizan para referirse a movimientos involuntarios violentos, como en la epilepsia. Los médicos pueden decir, ¿cuándo perdió el conocimiento? Aquí hay un pasaje de un libro de 10 sobre las causas. Sobre las causas de la pérdida de conciencia. El diagnóstico diferencial del ensayo entre un ataque epiléptico y un ataque sincopal. Desmayo, síncopes, pérdida repentina de la conciencia debido a una falla temporal de la circulación del cerebro. De estrés severo o cometido. Incontinencia urinaria, pérdida de control de la vejiga, incluso un ataque sincopal. Por lo tanto, ninguno de esos es específico para un ataque epiléptico. Las claves para establecer la presencia o ausencia de síntomas prodrómicos, síntomas que ocurren inmediatamente antes del ataque. Los episodios sincopales pueden estar precedidos por síntomas de mareos y aturdimiento. Muchas personas pueden recibir una advertencia, conocido como aura, que es un ataque en vagite. Nota: el sustantivo convulsión a menudo se usa en forma plural, tuvo convulsiones cuando era niño. Complete the table with 4 words from A, B, C opposites. Adjective, noun, blind, blindness, cons- conscientious, conscientiousness, deaf, deafness, dizzy, dizziness, numb, numbness, lightheaded, lightheadedness, unsteady, unsteadiness. Make word combination using word from egg book box. Look at A, B, and see opposite to help you. Double vision, epileptic fit, paternal symptom, psychopal attack, urinary incontinence, visual acute. A doctor is trying to determine the case, the cause of loss of consciousness in 42-year-old man. Complete the doctor's question. Look at the opposite and at the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movement while we were unconscious? The nervous system, the motor system. Examination of the motor system shall include access of the following: muscle bulk, amount of muscular tissue, leukoprotein of weighting, muscle atrophy, muscle tone, amount of tension in a muscle when it is relaxed. Tone can be increased, spasticity, or decreasing flaccid. Muscle power, strength, coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Reflex, see B below. Involuntary movement, for example, lateral tremor. He is an extract from a case report about a patient with which tremor. Case Case 80. On examination, her face showed little. On examination, her face showed little or no expression. There was a tremor affecting male in her right hand. She had generally increasing muscle tone, power, reflexes, coordination, and sensation were within normal limits. Examination of her gait showed that she was slow to start walking and had difficulty stopping and turning. Sí, sistema nervioso 2. El sistema motor. El examen del sistema motor debe incluir la determinación de la siguiente masa. Masa muscular, cantidad de tejido muscular, busque signos de atrofia a modo de desgarre. Tono muscular, cantidad de tensión en un músculo cuando se relaja. El tono puede aumentar, espasticidad o disminuir flacidez. Potencia muscular, fuerza. Coordinación, la capacidad de usar varios músculos al mismo tiempo para realizar ejercicios complejos. Acciones. Andar, manera de caminar. Reflejos, ver para abajo. Movimientos involuntarios, por ejemplo, un tic o un temblor. Aquí hay un extracto de un informe de caso sobre un paciente con temblor. Caso 80. En el examen su rostro mostraba poca o ninguna expresión. Había un temblor que afectaba principalmente su mano derecha. En general había un aumento del tono muscular. El poder, los reflejos, la coordinación y la sensación estaba dentro de los límites normales. El examen de su mano, de su modo de andar, mostró que era lenta para comenzar a caminar y tenía dificultad para detenerse y girar. Tendon reflex. Examination of the nervous system normally includes testing the tendon reflex, for example, the knee jerks, with a tendon Hafner, also known as a reflex Hafner. The reflexes may be absent, diminished, normal, or breaks. The plantar reflex are also checked. The normal plantar response is a downgoing movement plantar flexion of the big toe. A 0.2 extensor of Babinski response is abnormal. Kiuma. Kiuma is unconscious with a reduced response to external stimuli. Doctors say the patient is in a coma. The patient is comatose. The Glasgow Coma Scale (GCS) scoring is calculated as follows: eye opening, spontaneous, to speech, to pain, known; verbal response, oriented, confused, inappropriate, incomprehensible, known; motor response, obeys, localized with draws reflection station, known; reflejos tendinosos. El examen del sistema nervioso normalmente incluye probar los reflejos de los tendones, por ejemplo, los reflejos de las rodillas, con un martillo de tendones, también conocido como martillo de reflejos. Los reflejos pueden estar ausentes, disminuidos, normales o enérgicos. Los reflejos plantares también se controlan. La respuesta plantar normal es un descenso, movimiento de flexión plantar, del dedo gordo del pie, o un dedo del pie hacia arriba, extensor de la respuesta de Buckingham, anormal. Coma. Coma es la inconsciencia con una respuesta reducida a los estímulos internos. Los doctores dicen el paciente está en coma. El paciente está comatoso. La puntuación de la escala de coma de Glasgow, GCS, se calcula de la siguiente manera. Espontáneo, él habla, siente dolor, ninguna. Orientado, confuso, inapropiado, incomprensible, ninguno. Obedece, localiza, retiros, flexión, extensión, ninguna. Exercise. Complete the table with words from A, B, C opposite. No. Adjectives. Absent. Diminution. Diminiscence. Flaccid. Spastic. Wasted. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is assessing in a case. Look at A opposite to help you. I like you to relax. I'm just going to move your arm and down, muscle down. Can I see your hands? Muscle bulk and possibility in involuntary movement. Now I'm going to straighten your arm out. Try to stop me. Power. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Complete the sentences. Look at A, B, C, and opposite, and on the table in 27.1 about to happen. A flaccid hen droops limply to form a right angle with the ears. Reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. Activity is a form of involuntary movement. A gait is often used to test the plantar bones. His coordination was poor. He could not perform rapid alternative movement. A reflex fragment is used to test surfaces. When something is diminished, it is less than normal. A patient is brought to A&E in coma. When her name is Kim, she opens her eyes but she does not answer questions or OB interaction. What is her GCS score? Okay, GS is 5. Eye opening to speak. Verbal response, none. Motor response, none 1. Oncology. Neoplasms. A neoplasm is a normal new growth of tissue. Malignant neoplasm cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth of tumor. You have a small growth in the bowel. You have a small tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to neoplasms, but there are other causes such as inflammation or fluid accumulation. Patients say, I have a lump in my left breast. Doctors say, there was a firm palpable mass in the liver. Oncología. Neoplasia. Una neoplasia es un nuevo crecimiento general de una neoplasia maligna, cáncer, que probablemente se propague y cause una serie de enfermedades o la muerte. Son menos dañinos. Cuando hablan con los pacientes, los médicos generalmente dicen crecimiento del tumor. Tienes un pequeño tumor en el intestino. Tienes un pequeño crecimiento en el intestino. Un bulto o hinchazón es una acumulación de líquido que es visible o palpable. Se puede palpar con los dedos. Un bulto puede deberse a una neoplasia, pero existen otras causas como la inflamación o la acumulación de líquido. Los pacientes dicen, tengo un bulto en mi seno izquierdo. Los médicos dicen, había una masa firme y palpable en el hígado. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade local tissue or may spread to distant parts of the body. Metastasis. Neoplasms, which are the result of metastasis, are called secondaries and opposite to the original tumor, which is the primary. We have the results of the scan back now, and I'm afraid they show that you have a small growth. Is the prostate. For today, it appears to be at an early stage, and there is no sign of spread. So if we remove, there is every chance of a complete cure. Note, to invade bird is to enter and spread throughout a part of the body, and this process is invasion. No. If your tumor is described as invasive, it has the ability to spread. Los tumores malignos se caracterizan por su rápido crecimiento e invasividad. El tumor puede invadir tejidos locales y diseminarse a partes distantes del cuerpo. Metástasis. Las neoplasias que son el resultado de metástasis se denominan secundarias, a diferencia del tumor original, que es el primario. Ya tenemos los resultados de la exploración y me temo que muestran que tienen un pequeño crecimiento en la próstata. Afortunadamente parece estar en una etapa temprana y no hay signos de propagación. Entonces, si lo eliminamos, hay muchas probabilidades de una cura completa. Nota. Invadir, verbo, es entrar y extenderse por una parte del cuerpo, y este proceso es invasión, sustantivo. Si un tumor se escribe como invasivo, tiene la capacidad de diseminarse. Symptoms and signs of malignancy. The symptoms of malignant diseases may be related to the site and location of the tumor. For example, a space occurrent lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct blood, the lumen, and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 45. A 23-year-old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kg in weight. He was also complaining of night sweat. He had no significant past medical history. Síntomas y signos de malignidad. Los síntomas de la enfermedad maligna pueden estar relacionados con el tamaño y la ubicación del tumor. Por ejemplo, una lesión que ocupa espacio en el cerebro provoca un aumento de la presión intracraneal y síntomas como dolor de cabeza, vómitos o trastornos visuales. Los trastornos del colon pueden destruir, bloquear la luz y causar cambios en el hábito intestinal. Otros posibles síntomas de malignidad incluyen sangrado, dolor y pérdida de peso. Caso 55. Un hombre de 33 años se presentó a su médico de cabecera quejándose de un bulto indoloro en el lado derecho de su cuello. Que había estado presente durante aproximadamente 2 meses y estaba aumentando de tamaño. Se había sentido mal en general y había perdido unos 5 kilos de peso. También se quejaba de sudores nocturnos, no tenía antecedentes médicos significativos. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which it only instant relieves symptoms. Tratamientos de tumores. A veces un tumor puede extirparse por completo o extirparse mediante cirugía. Si esto no es posible, por ejemplo, si ya ha hecho metástasis a otras partes del cuerpo, puede ser posible destruirlo mediante radiografía o quimioterapia. Cuando la cura no es posible, se da un tratamiento paliativo que solo pretende aliviar los síntomas. Exercise. Complete the table with words from A, B, C, and opposite to and relapsed forms. Verb, cure, noun, nouns, cure. Adjective, curative. Exercise, excision. Grow, growth. Invade, invasion. Invasive. Obstruction. Obstruction. Obstructive. Palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spread. Spreading, swell, swelling, swelling, swollen. The notes below are about the patient described in B opposite. Use them to put the sentences in the correct order. To make the next for a paragraph of the case report, use the appendix 2 on the page if you need help with the abbreviation. Okay. One is, on examination, his temperature was 37.8 Celsius. 2. There was a smooth, firm 3.4 cm mass in the right supraclavicular fossa. 3. There were large lymph nodes in both axilla and inusual areas. His mouth and throat were normal. His pulse rate was 100/min, regular, and blood pressure 112/66. His cardiovascular and respiratory system were normal. On abdominal examination, there was a mass papal 3 cm below the left costal margin. Examination of the central nervous system was normal. Complete the sentences. Look at A, B, and C opposite to help you. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite, the painful, is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasis are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Pregnancy and childbirth. Childbirth. The exact day of delivery. EDD is date on which a woman is expected to give birth to the child she is carrying pregnant with. It is calculated by adding 280 days or 14 weeks to the first day of the last menstrual period, LMP. Childbirth is also referred to by doctors as parturition. Delivery is the process of helping the child to be born. A spontaneous vaginal delivery, SVD, is a normal delivery. If there are complication, the baby may be delivered by cesarean section, surgical removal. A full-term pregnancy is 40 weeks, divided into three trimesters. A baby who is born before this is premature, and one born after 40 weeks is post-mature. A baby who is born dead, for example, because the umbilical cord is around its neck, stillborn. A pregnancy made before term spontaneous with miscarried spontaneous abortion, or be delivered terminated with induced abortion. Termination of pregnancy. No, the word induced means to cause something to happen. Embarazo y parto. Parto. La fecha esperada de parto, por sus siglas en inglés EDD, es el día en que se espera que una mujer dé a luz al niño del que está embarazada. Se calcula sumado 280 días o 40 semanas del primer día de su última menstruación. El parto también es temido por los médicos como partición. El parto se procederá al niño a salir. Un parto vaginal espontáneo es un parto normal. Si hay complicaciones, el bebé puede nacer por cesárea, extirpado quirúrgicamente. Un embarazo a término es de 40 semanas divididas en 3 trimestres. Un bebé que nace antes de eso es prematuro y uno que nace después de 40 semanas es postmaturo. Un bebé que está muerto, por ejemplo, por el cordón umbilical, está alrededor de su cuello, puede terminar antes de brotar espontáneamente. Un aborto espontáneo o terminó delirante como un aborto provocado, la interrupción del embarazo. Nota, el verbo inducir significa hacer algo que sucede. The process by which the fetus and placenta are pushed out the uterus is called labor. It is divided into four stages, some words which are combined with labor are premature labor, prolonged labor, spontaneous labor, induced labor, fails labor, trabajo de parto. El proceso por el cual el feto y la placenta son expulsados de los se denomina trabajo de parto. Se divide en cuatro etapas. Algunas palabras que se combinan con trabajo son trabajo de parto prematuro, trabajo de parto prolongado, trabajo de parto espontáneo, trabajo de parto falso y trabajo de parto inducido. Presentation and lie. Fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occupies the center of the pelvic canal and which the examining finger feels on vaginal examination. Butterworth. The normal presentation is with head vertex presentation. Bridge presentation means the buttocks are presenting bridges, an old word for buttocks. Abnormal presentations may require delivery with forceps. Presentación y mentira. La mentira fetal es la posición del feto en el útero. La postura. La postura normal es longitudinal y la postura anormal es transversal. La presentación cerebral se refiere a la parte del feto que ocupa el centro del canal pélvico y que el dedo examinador toca en el examen vaginal. La presentación normal es como la cabeza, presentación de vértice. La presentación de nalgas significa que se presenta de nalgas. Nalgas es una palabra antigua para las nalgas. Las presentaciones anormales pueden requerir parto con forceps. Exercise. Complete the sentences. A baby that is born a week before the EDD is premature. A termination pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor. Is an indication for cesarean section. It was a bridge presentation and delivery was by forceps. In a miscarriage, another term for a spontaneous abortion. The umbilical was one tie around the baby's neck and in the was infertility, stillborn. Complete the table with work from A opposite. Verb, noun. Abort, abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Presentation. Terminating, termination. Dr. Bennett, an SHO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her first obstetrics history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneous aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at four 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section.